Our bodies are finely tuned machines. They need the right conditions to function properly. One crucial aspect is the balance between acidity and alkalinity. This balance, measured by pH, is vital for our cells and organs to work correctly. A pH of 7 is neutral. Lower pH means more acidic, while higher means more alkaline. Our lungs play a crucial role in maintaining this balance. They control the amount of carbon dioxide, or CO2, in our blood. CO2 is slightly acidic. When we breathe out, we remove CO2. This helps to regulate our blood's pH level. When this balance is disrupted, it can lead to health problems. Respiratory acidosis and alkalosis are two conditions that occur when the lungs cannot maintain the correct pH balance. These conditions can be serious, but with proper understanding and treatment, they can be managed effectively. Respiratory acidosis occurs when your lungs can't remove enough CO2 from your bloodstream. This causes the CO2 to build up, making your blood more acidic. Remember, higher CO2 levels lead to lower pH, meaning higher acidity. Our bodies are incredibly adaptable, but they have limits. When the pH of our blood goes outside the healthy range, our cells can't function as they should. This can affect every system in the body. Several factors can hinder our lungs' ability to remove CO2 effectively. These include chronic obstructive pulmonary disease, COPD. Conditions like emphysema and chronic bronchitis can obstruct airflow, trapping CO2 in the lungs. Asthma. During an asthma attack, inflamed airways restrict breathing, leading to CO2 buildup. Pneumonia. Infection in the lungs can interfere with gas exchange, affecting CO2 removal. Obesity. Excess weight, especially around the abdomen, can restrict lung expansion and impair breathing. Opioid overdose. Opioids depress the respiratory center in the brain, slowing breathing and increasing CO2 levels. These conditions highlight the critical link between our respiratory system and overall well-being. Promptly addressing these issues is crucial to prevent respiratory acidosis and its complications. Recognizing the symptoms of respiratory acidosis is vital for early intervention. Common signs include headache. The increased CO2 levels can dilate blood vessels in the brain, causing headaches. Drowsiness and confusion. High CO2 levels can interfere with the brain's oxygen supply, leading to fatigue and difficulty thinking clearly. Rapid breathing. As the body tries to expel excess CO2, breathing becomes faster and shallower. Increased heart rate. The heart works harder to circulate oxygen in the face of rising CO2 levels. If you experience these symptoms, especially in conjunction with known risk factors, seek medical attention immediately. Section 5. Respiratory alkalosis. Breathing too hard, too fast. Respiratory alkalosis presents the opposite scenario. Here, the body loses too much carbon dioxide, making the blood more alkaline. This usually occurs due to rapid or deep breathing, also known as hyperventilation. While it might seem counterintuitive, having too little carbon dioxide can also disrupt the body's delicate balance. This imbalance can lead to a cascade of problems if left untreated. Section 6. Causes of respiratory alkalosis. What makes you breathe so fast? Several factors can trigger hyperventilation and lead to respiratory alkalosis. These include anxiety and panic attacks. Intense fear or anxiety often triggers rapid, shallow breathing. Pain. Severe pain can cause us to breathe faster as a reflex. Fever. The body increases its breathing rate to cool down during a fever. Lung diseases. Conditions like pneumonia or pulmonary embolism can disrupt breathing patterns. High altitude. Lower oxygen levels at high altitudes can initially cause us to breathe faster. It's important to note that hyperventilation is often a symptom of an underlying issue. Identifying and addressing the root cause is crucial for effective treatment. Section 7. Symptoms of respiratory alkalosis. How does it feel? The symptoms of respiratory alkalosis are closely tied to its effect on the nervous system and blood vessels. Common signs include dizziness and lightheadedness. Reduced CO2 levels can cause blood vessels in the brain to constrict, leading to dizziness. Tingling in the extremities. Changes in blood flow due to low CO2 can cause numbness or tingling sensations in the hands and feet. Muscle twitching. Electrolyte imbalances caused by alkalosis can disrupt muscle function. Fainting. In severe cases, reduced blood flow to the brain can lead to fainting. If you experience these symptoms, particularly in conjunction with rapid breathing, seek medical attention promptly. Section 8. Restoring the balance. Treatment for acidosis and alkalosis. Treatment for both respiratory acidosis and alkalosis focuses on restoring the body's pH balance. This often involves addressing the underlying cause of the imbalance. For respiratory acidosis, oxygen therapy. Supplemental oxygen can help increase the amount of oxygen in the blood. Medications. Bronchodilators can open up the airways to improve breathing. Mechanical ventilation. In severe cases, a machine may be needed to assist breathing. For respiratory alkalosis, slowing breathing. Techniques like breathing into a paper bag or pursed lip breathing can help raise CO2 levels. Treating the underlying cause. Addressing anxiety, pain, or other triggers is essential. Medications. In some cases, medications may be used to manage anxiety or other underlying conditions. It's important to remember that self-treating these conditions can be dangerous. Always consult a healthcare professional for proper diagnosis and treatment. Section 9. Breathe easy. A reassuring note. Respiratory acidosis and alkalosis are serious conditions, but with prompt diagnosis and treatment, most people can make a full recovery. Understanding the causes, symptoms, and treatment options empowers us to take control of our respiratory health. By recognizing the vital role our lungs play in maintaining our body's delicate pH balance, we can make informed decisions to protect our health and well-being. If you have any concerns about your respiratory health, don't hesitate to speak to your doctor. Remember, prevention is always better than cure.